Good afternoon, everyone. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on psoriasis. Psoriasis, a condition in which skin cells build up and form scales and itchy, dry patches. Psoriasis is thought to be an immune system problem. Triggers include infection, stress, cold. The most common symptom is a rash on the skin, but sometimes the rash involves the nails and joints as well. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 to 60 years old. It affects men and women equally. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its type, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Sachin Manohar Shetty, who is a skilled and experienced dermatologist who is dedicated to helping his patients to achieve healthy, beautiful skin. With years of experience in this field, Dr. Shetty has a deep understanding of the complex and varied needs of his patient, and he is committed to providing personalized care to each and every one of them. Dr. Sachin Manohar Shetty is currently working in Puttur Skin Clinic and Laser Center, Karnataka. A very warm welcome to you, Dr. Sachin Manohar Shetty. It's a pleasure to have you with us, Doctor.
Thank you. Thank you.
And
Uh,
doctor, as today we are going to talk about psoriasis, a problem which is, which involves the skin, which is normally seen on skins. But again, it is so common, and people are so less informed and are not very aware about it. So we would like to discuss this topic today, doctor, with you. And to start with, we would first like to understand what is psoriasis.
See, the psoriasis, whatever the disease is there, it's been there since millennium. Even in Ayurveda, in all the old textbooks, it's there. So it's been there since long time. It's not a recent modern disease, and the awareness of this disease has been, it's improving from last few decades, and that even the treatment has been improving since last few decades. So psoriasis is, as such, it's a type of what we can say is an autoimmune disease. It's been classified as an autoimmune disease, which has even the metabolic implications as well. So what do you mean by autoimmune is your own immune system is attacking your own body. Like there are different autoimmune diseases in different attacking different organs of your body. Similarly, there are some cells in your skin which are important, which regulate the division of the cells and formation of new skin layer in your skin. So when these cells are being attacked by your own immune cells, uh, these psoriasis lesions occur in your body. So if you ask how common is it is, as per the recent statistics, every one person out of 50, 1 in 50 person in the world is suffering from psoriasis in one way or the other, either skin, nail, or psoriatic arthritis. So it's very common, if we can say. And if you ask me what is the most common cause, so there is no particular cause for this, but as for the research, there is mainly two factors. One is the genetic factors. So mainly the genes which can be transmitted from parents or grandparents to offsprings. So along with these genes, even the environmental factors are also come into play for the onset of psoriasis. So it's a very common condition, and the treatment is also very long term, and there are good medication, good treatment nowadays. So the patient needs to be aware that one of the main implication of psoriasis is the psychological impact and the stress and depression, all these factors. So the treatment is very important. Early detection and prompt treatment is very important, is what I can say.
Right. And doctor, as we are talking about psoriasis, and people are so scared, so afraid of this particular condition, skin condition, it can also be on nails and joints, as you have already mentioned. But one thing that all of us wants to know is it contagious? Can I get psoriasis from somebody?
Okay, it's a very common question when patients ask. One of my relatives or one of my friends is suffering from psoriasis. Does it spread? No, it doesn't spread. It is a non-contagious disease. It doesn't spread by contact, close contact, physical contact, or by touching or eating together. It doesn't spread. It is not contagious. However, some people feel that, in the family, as I said, since it's hereditary, if the father or mother has psoriasis, the chances of children getting psoriasis is more. It doesn't mean that the kids should get it, but there are chances, and the chances, I mean, the percentage varies. In some studies, it says 10 to 20%. In some studies, they say up to 40, 50%. But the chances are there. So this makes them think that, it has been spread because they live together, the parents, children. So it doesn't spread like that. It's usually because of the hereditary, the genetic, this thing. I mean, the recent studies say that it's purely genetic. Some of the studies, the HLA association and all, so they say that it's purely genetic. So when the genes are involved, the chances of being transmitted to the offspring is more. So that is the only way psoriasis can spread. It's not contagious.
Fair enough. And doctor, is it true that people who have dry skin are more likely or at higher risk of having psoriasis? And if that's so, what are the other risk factors as well?
See, what happens is the genetic predisposition. Okay, everyone out of 100, if, for example, so many people will have that genetic abnormality of psoriasis, if you can think like that. And there are other second trigger, like one genetic predisposition, along with that some other trigger. What the other triggers, like that's what the dry scaly skin and stress and all those things. So one of the triggers is the dry scaly skin and repeated bacterial infections and trauma. See, the trauma is one of the major factors because there's something called as Kobner's phenomenon. So whenever there is any injury to the skin, the as the wound heals, the chances of the new psoriatic lesion coming in that area is more. So all these, like trauma, dry, scaly skin, are also one of the triggering factors for psoriasis. As well, when the patient are suffering from psoriasis, if the skin is more dry, the chances of flare-up are more. That's why patients get more flare-ups during winter and dry seasons. So if patients can prevent the dryness by regular moisturizing or avoiding water bath and using loofah scrubs and all, so the flare-ups can be reduced. But as such, everyone with dry skin won't be getting psoriasis. There should be a predisposition, and along with that, this dry skin adds to the extent of the or degree of the severity of psoriasis.
Right. Now, what happens, doctor? In our society, we have this tendency of doing a lot of hit and trial, and experimenting on our skin is very common. We do a lot of home remedies. So, when we have any kind of skin issue or infection, we'll first try something inside our kitchen or our homes, some home remedies, or we'll ask a friend or family.
Hmm.
And we go to that extent where we can take their prescription, go get the medicines, and start treating ourselves. We also have over the counter medications so easily available. We'll go ask the chemist that, see, this is what is happening on our skin. Please suggest something. It's only when the condition worsens or goes out of control that's when we go and consult a qualified dermatologist. Now, my question to you is, do these home remedies, asking a friend, family, or going for over the counter medication, do they work?
See, the main what we have to understand the psychology is if they might have heard that it might be a severe condition, it might be something no, it doesn't have any treatment. They might have heard someone saying that it might be psoriasis. So the patients get scared to get themselves diagnosed. So that is the main problem I feel. The patients are not ready to accept that that might be psoriasis. It might be some kind of allergy or something like that. So they keep trying different home remedies, online this thing videos. They see, they apply everything, and then when they feel that it is not coming down, I think now it's the time to go show it to a doctor. Sometimes that condition might have gotten worse. So the sometimes what happens, it starts at particular area, one area, and it might keep on increasing in size. So maybe after, if they wait for 6 months to 1 year, sometimes this very small lesion or plaque which might have been cured just with the creams, no, might have gotten very worse and gotten spread all over the body, which might need a long term tablets, which have, some of the tablets might have a mild side effect also. So instead of simply trying and experimenting, uh, I think, yeah, it's always better to first go yourself diagnosed. No, acceptance is the first way to cure. So you have to accept that you are suffering from that, and you have to find a solution from a qualified person. So asking a layman about all these things and getting the information online is a very bad way to start, I think.
Right. And there are so many influencers these days on social media. Then there is quacks, etc. So it's always better to,
Yes.
not waste our time, energy, our money, and most importantly, our health on these over-the-counter medication, home remedies, or
Yes.
influencers, etc. Please go to the right person, which is a qualified dermatologist in case of psoriasis. And that's the whole purpose of having this session, so that we can spread awareness and also tell us about what is psoriasis, how to get it treated. Now, when a person comes to you, doctor, how do you diagnose? Are there any tests that you normally suggest, or just by clinical investigation you can tell that yes, this is psoriasis and this has to be done?
Uh, the thing is, the classical diagnostic feature, if it's there, like raised red patch with the silvery scales, what they say. So the powdery scales, the dead skin will peel off. So usually it is seen in the extensor, like elbows, then knees, then sometimes in the scalp and back. So if these are classical lesions are there, there is no need for any other confirmation test. But if there are some, as you said, if they apply some over-the-counter steroids or taken some treatment, the classical diagnostic the picture won't be there. So at that time, the maximum we can do is we can take a skin biopsy, punch biopsy, and send it to histopathology lab and confirm with the histopathology report. And other than that, I don't think any other diagnostic test is required as such, unless if they have only psoriatic arthritis, then maybe X-ray of the joint can be taken. Or if there is any dystrophy, I mean complete destruction of the nail, nail biopsy can also be taken. So maximum investigation which we can do to confirm psoriasis is biopsy, I think, skin biopsy. That is the maximum we can do.
Okay, doctor. And doctor, you have already, mentioned a bit about the treatment options, but we would like you to shed some more light. What are the treatment options available?
So treatment option, it's like a step ladder. So we start from the basic, like the simplest one first. That is the topical creams, ointments, lotions. Mainly these contain some anti-inflammatory medications like steroids, then steroid sparing drugs like methotrexate, then topical tacrolimus and all these things. They made what they do is they calm the inflammation down. They reduce the redness and reduce the scaling. So these are usually preferred in patients who have very mild to moderate psoriasis and very limited number of patches. And if the severity is more, if there is moderate severity psoriasis, we can go into phototherapy as well. In phototherapy, what we do is we irradiate the skin with the ultraviolet light, specific wavelengths of ultraviolet light. every alternate day or once or twice in a week. So what this does is the basic principle is this ultraviolet light, it gets absorbed by the inflammatory cells in the skin, and they die off. So the inflammation gets reduced with this phototherapy. So along with the phototherapy, we can also moderate to severe type of psoriasis. We can include oral medications as well. So oral medications, usually what they do is they usually reduce the inflammation, and the mainly most commonly used oral medication is immunosuppressants. It reduces your as I said, it is an autoimmune condition, so your own immune system is overactive. So what we have to do is we have to calm the immune system down. So immunosuppressant drugs like methotrexate, cyclosporin, then all these many and immunosuppressant drugs are in use, but depends on the severity of the and recent what do you say advance is that there is something called as biologics. So what they do is they mainly target specific immune mediators. It's called interleukins or cytokines. So what these biologics do is they go target a specific immune what chemicals which regulate the immune system. So even these biologicals are very good and they advanced. The only thing is they are on the expensive side, and many people in India can't afford it. So these are the recent advances. So these are the different step ladder treatments. The basic coming from creams, ointment, lotion to phototherapy to oral medications to biologics.
Right. And as we were talking before, doctor, that psoriasis can get to your knees, psoriasis can get to your joints, which is also known as psoriatic arthritis. We would like you to explain them a bit as well.
Psoriatic arthritis, there are different types. There are different types. There might be small joint might be involved, like the small joints of the fingers and toes, and large joints can also be involved, like the elbow, knee, and ankle, and also some of the vertebrae can also be the axial skeleton, what we call. So even they can be involved. So there are different types of psoriatic arthritis. And usually, what we have seen is the psoriatic arthritis is seen usually in patients who have nail involvement. So, nail involvement is one of the cautionary sign for psoriatic arthritis. So, the treatment basically is the same. Usually, have a treatment alongside with the orthopedician or a rheumatologist. So, we go hand in hand. The treatment almost remains the same, but sometimes the joint involvement might need intra-articular injections and some other treatment modalities, which we treat the patient along with the as a team. So
Right.
that is one of yes.
Okay, doctor. We have a viewer with us, Tina Bhaga. Her question is, how can I best manage the emotional and psychological impact of psoriasis?
Yes, definitely. It has a lot of emotional and psychological impact. So the main way is to uh, get yourself treated first. You get yourself diagnosed properly and get yourself properly treated. And as we know, there is no complete cure for psoriasis as such. Some variant of psoriasis, like guttate psoriasis, is called, tiny rashes on the body. It has been seen that it is gets completely cured. But other types of chronic plaque psoriasis or other type of psoriasis doesn't get cured completely, but it can be maintained. The normal skin can be achieved, but with the regular treatment. So getting a regular treatment is the first step. And other thing is getting help. There are so many associations. There are so many societies, self-help groups, which all the patients with psoriasis world over, they come together in one forum. And I think you can search online. There are so many forums which helps other patients, new patients with psoriasis, overcome those psychological and emotional this thing. And you can also talk to a close friend, or get a help from a counselor or
Right.
therapist. So that there are different ways. So the first way is getting the disease under control. I think if the disease is under control, I think the all this ecological impact can be reduced by
Right. And doctor, we have Rahul with us as well. Rahul's question is, can psoriasis increase my risk of developing other health conditions?
Yes, yes. Recently, there has been a lot of research going on. So, psoriasis is also being now classified as a metabolic disease. So, there are a lot of association like hypercholesterolemia, hypertension, then diabetes, type 2 diabetes mellitus, and risk of getting cardiovascular disease. So, all these metabolic abnormalities, what we call like lifestyle diseases. So, psoriasis has a association with this. So definitely, patients with psoriasis are prone for these metabolic abnormalities like hypertension, dyslipidemia, hypercholesterolemia, then diabetes, and ischemic heart disease also. So this actually matters a lot because if the psoriasis is not under control, so the chances of going, getting all these associated diseases is more. So getting the psoriasis under control as well as getting evaluated for all the other metabolic conditions is also very important.
Right. And many times people ask doctor, those who are suffering from psoriasis, that how long I need to continue the medication.
uh, See, there are many patients who get treated once the lesions everything gets resolved. They come stop the treatment for 6 months or 1 year. So sometimes what we see is for 1 year or 2 years there is complete remission. There is no recurrence of the psoriasis. So and after some time there is a stressful event or a fever or an accident or something like that. So it aggravates again. So there is a waxing and waning type of disease. So
Right.
once there is, they take the treatment, it completely resolves. Many of the patients they stop the treatment, and after some time it comes back. It comes with the vengeance actually. So the best thing to do is, if their psoriasis is severe, we can take oral medications, till it's calmed down. Maybe then after some time we can reduce the dosage of the medicines to the minimal. So the what is the minimal most minimum dose which your body requires to control it. So that can be maintained. Along with that, regular moisturizer and topical creams to prevent aggravation, can be continued for some years, I think. But there is no particular answer if you ask me for how many years they can continue, because maybe the research is going on. In some years, new drugs are underway, and there might be a complete cure in some years. So till then, maybe you can continue with this medicines and creams and get it under control, so that when the new treatment comes, you can go for it.
And doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, the main take-home message would be to get completely diagnosed by a qualified dermatologist, get yourself treated properly, and don't get so depressed by seeing all those online this thing. So when you put some the basic symptoms, the internet or Google gives cancer for you. And similarly with this condition as well, not all rashes are psoriasis. Don't think all rashes are psoriasis. There are thousands of skin diseases. Not everything works the same for everyone, and every disease has a different treatment. So first thing first, you have to get yourself evaluated by a qualified dermatologist, get yourself treated, and if you have any other emotional or depression and all those things, get a help. There are so many websites and forums, self-help groups. Patients they discuss among themselves the different things which can even one of the main important things I forgot to tell is the lifestyle changes. So lifestyle changes is very important along with the treatment for psoriasis, like quitting alcohol and stopping smoking, and reducing the junk food, especially high glycemic index food. So all this comes a long way. Along with the treatment, if you change the lifestyle, maybe you can reduce the dosage of the tablets, all those medications, and that's a main takeaway, I think.
Thank you so very much, Dr. Sachin Manohar Shetty. It was wonderful talking to you, and thank you for this very informative session. Thank you once again.
Thank you for having me. Thank you.
Thank you, Doctor. It was a pleasure. And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.